Essentially, there are two major groups when we're talking about placement of implants. And then there's really a third group that is a combination of those two major groups. So there's the submuscular, which means the implant is placed mostly under the main chest muscle, which is the pectoralis major muscle. And the other major option is subglandular, which means the implant is placed below the breast gland but on top of the muscle. And then there's really a third option where the upper part of the implant is under the muscle and the lower part of the implant is really on top of the muscle, and this we call the dual plane approach, which I perform quite frequently. Essentially, there are advantages and disadvantages of both approaches, and there really is not just one way depending on the patient. But in general, for general considerations, for someone who is very thin and has very thin tissues and doesn't have a lot of their own breast tissue to cover the implant, it's generally considered better to obtain more tissue coverage over the implant by putting the implant under the muscle. In a heavier person, someone who has larger breast or thicker tissues of their own, we have more leeway in placing the implant over the muscle or in the subglandular position. There are definitely advantages and disadvantages of both. In my practice, I probably perform about 60% under the muscle, probably about 15% over the muscle, and the rest I probably do the dual plane procedure, which combines the benefits of both under the muscle and over the muscle, and is suited for certain patients, particularly those where the breast sits a little low.